As medical science advances, people lifespan is increasing. So number of elderly patients are increasing. So these patients are suffering from different neurodegenerative conditions. One of them is Alzheimer's dementia, Parkinson's disease. But I am getting a lot of patients who are suffering from dementia. And to give the proper service of the dementic patient, I like to make a knowledge about the dementia and also to help those patients who are suffering from forgetfulness. So this inspires me to do work for the elderly people to make a quality of life for them. For early sign of Alzheimer's disease is patient is unable to remember new information. They forget the new things what they have kept in the house, daily events they forget. They cannot keep the appointments, and they forget conversation. These daily activities will be hampered, and this first thing is that they cannot recollect the new information, because in Alzheimer's patients there is a hippocampal atrophy, and this hippocampal is responsible for our learning and memory. And this hippocampus, when atrophy, the patient cannot remember the new information. They can remember the old things, but never the new things, because the hippocampus becomes atrophy in case of Alzheimer's disease. And other organs which can also affected in Alzheimer's dementia, that is cerebral cortex. And the cerebral cortex and hippocampus, there are two pathological hallmarks for Alzheimer's disease, and that is amyloid plaque and neurofibrillary tangles. And these produces neuronal cell destruction, particularly in hippocampus, so patient cannot remember the new information. And this can be missed by their relatives, that day by day events this person cannot remember. In my early practice life, we diagnose dementia clinically. That means that whether it is a degenerative dementia, whether it is Alzheimer's dementia, or frontotemporal dementia, or Lewy body dementia. So, or Parkinson's disease dementia, these are the degenerative dementia. And non-degenerative dementias are vascular dementia, dementia due to hypothyroid, vitamin B12 deficiency, and there are some structural defect of brain which can lead to dementia, such as normal pressure hydrocephalus and also chronic subdural hematoma. So to find out the proper dementia, we have to base on clinical tests such as mini-mental state examination, Montreal cognitive assessment test, and other things is MRI of the brain, and also we are doing some blood test. So we can diagnose the dementia, but whether it is Alzheimer's dementia, which usually forms the 60 to 70% of all dementias. So to diagnose Alzheimer's dementia, there was no biomarkers. But recently, there are a lot of biomarkers has come which can help our patients to diagnose as Alzheimer's dementia. And these biomarkers are blood biomarkers, CSF biomarkers, amyloid PET. And this investigation help us to confirm the diagnosis of Alzheimer's dementia, because Alzheimer's dementia constitutes 60 to 70% of all dementias. So we must recognize the Alzheimer's dementia. So there is a lot of change from early practice to now. Dementia is a progressive disorder, neuroprogressive disorder and neurodegenerative disorder, and the patients, as the disease advances, patients' quality life gradually decreases. So patient forget, patient cannot maintain a good life, And there is a sometimes there this in Alzheimer's dementia, main problem is the memory loss of memory. The patient cannot find, they cannot keep their appointment. They cannot. Sometimes they forget whatever where they have placed their things. So as the disease progresses, so our deterioration becomes more, and so patients, the patient becomes quality of life decreased, and he requires help of the others, and he cannot going on independently. So Alzheimer's disease patients and caregivers are always busy. Caregivers are particularly busy to help his patient. So it is a great challenge. Now time has come to help the patients more precisely. So if clinically after when there is an objective evidence of cognitive impairment, so we go for the biomarkers, and these biomarkers help the patient directly for diagnosis of Alzheimer's dementia, particularly CSF biomarkers, blood biomarkers, and amyloid PET. And if we can diagnose the Alzheimer's disease in early condition, early stage, so we can help also the patient, because and now the anti-amyloid therapy has come, which is very, very useful in case of early disease of Alzheimer's, early stage of Alzheimer's disease, and that can slow the disease progression. So now the challenges we are facing. So we must take the help of biomarkers, and if it is positive in early life, because we know that Alzheimer's dementia starts 10 to 20 years before the symptom onset. So if we can diagnose the patient in early stage, particularly in minimum cognitive impairment, when the patient's cognitive impairment is there, but no functional impairing. So in those cases, if we can diagnose and by doing biomarkers and starts the anti-amyloid therapy, we can slow the disease progression. So patients will not be in bad condition, and quality of life will not be decreased. Because a lot of research is going on, and Alzheimer's patients are now very, it can be diagnosed a very good way, because there are a lot of biomarkers that they are particularly previously to a CSF biomarkers, which is an invasive procedure, and sometimes patient doesn't agree. And there is a PET, amyloid PET, that is very costly, and that has a radiation hazard. Recently, there is a blood biomarker by which in early Alzheimer's disease patient, if we do the blood biomarker, particularly tau P217, then we can diagnose that the patients. There are a lot of blood biomarkers. One is the alpha beta 42 and alpha 40, alpha beta 40 ratio. Another is phosphorylated tau 181, and another is phosphorylated tau 217. And this phosphorylated tau 217 is highly associated with amyloid PET and tau PET. And when the blood biomarkers ratio, if amyloid beta 41, 42 and amyloid beta 40 ratio is low, and high phosphorylated tau 200, 117 is how we can confirm that the patient's brain is suffering from Alzheimer's disease. So to diagnose the Alzheimer's patient, we are getting in easy way if we test the biomarkers, particularly blood biomarkers. I like to tell that time has come when you can diagnose your patient as a cognitive impairment. Clinically, first you do the mini-mental state examination, where we can see the memory impairment, which is the most important sign of Alzheimer's dementia. And another is that whenever you confirm that there is objective evidence of cognitive impairment, so you go for the biomarkers. And among all biomarkers, now blood biomarker is more convenient, because it's not invasive, it has no costly, it has no radiation hazard. So you do the blood biomarkers. Particularly now the in market it is coming that blood for p-tau 217, which is highly associated with amyloid PET. So by doing only the blood biomarker as phosphorylated tau 217, we can confirm that our patient is suffering from Alzheimer's dementia and early stage. So we can start the anti-amyloid therapy to slow the disease process. And there are some symptomatic drugs which can help for dementia patients, but disease processes continue. So now the anti-amyloid drugs has come, so it can help to. This is called the disease-modifying drugs, and it can help to slow the disease process. And also these biomarkers help us. So thank you for, and we must try for these things.